We have the great honor today of bringing back with us Robby Stern from PSARA, the Puget Sound Advocates for Retirement Action, which is a dynamic organization working very closely with Pramila Jayapal, working with other partners, and really one of the lead strategists and activist organizations fighting the privatization of Medicare. We'd love to hear your reflections, updates, thoughts going forward, Robby, where we need to be. Where does one pair of states need to be in this fight? And yeah, please just open it up and then we can bring back some conversation. Robby, thank you so much for being with us. And it was a great pleasure to get with you up in Seattle last month, breaking bread with some tacos. That was a lot of fun. Great to see you. Thank you so much.
Good to see you too, Chuck, and glad you made it through the tornadoes as you were traveling back east.
Yeah, and actually, I almost ran out of gas crossing the Mojave Desert. I came within 9 miles.
Oh my goodness.
It was kind of perilous.
Well,
Thank you.
I want to thank you for the invitation to be here. I thought that what I would try to do is give you the arc of the campaign that Puget Sound Advocates for Retirement Action has been running and sees ourselves running for several years to come, because this is a multi-year battle that we're engaged in. What we have to say to a lot of the folks that are talking about single payer, winning single payer, whether it's nationally or state-based, is thinking very carefully about how that will happen if the trend towards the privatization of Medicare continues at the rather rapid pace that it's happening. And we should be very, very aware that CMS, and particularly CMMI, is on a very determined course to privatize Medicare. And we are seeing that happening not only through Medicare Advantage, although Medicare Advantage is easily the largest, but we're also seeing it through the insertion of ACO REACH, the first time that we're dealing with capitated payments within the traditional Medicare system, and also the Medicare Shared Savings Program, which is another kind of large pilot program. It's not even a pilot anymore, and it was legislated, that's going on within traditional Medicare. And we just learned that CMMI has also authorized their first program, or not just, has authorized their newest program with Medicare Advantage, allowing them to offer people spending cards, flexible spending cards that can be used for food, for other costs that people are having, as an inducement to come into their Medicare Advantage program. And our members are receiving advertisements about that as an inducement to come into Medicare Advantage. So they're opening all stops to try and force people into Medicare Advantage at the same time that states and local jurisdictions around the country are rapidly also eliminating the benefit for retired public employees to be in traditional Medicare through their retirement program, and are forcing them into Medicare Advantage. And if they don't want to be in Medicare Advantage, then they're forced out of the retirement system and have to purchase traditional Medicare along with buying Medigap. So there is so many things that are happening right now that are an attempt to force people into privatized Medicare. So how PSARA is an organization of around 1,400 members here in Washington, all volunteer. We put out a monthly newsletter called the Retiree Advocate. We're an activist organization, and we are very much about fighting to preserve and expand Social Security and Medicare, along with participating in issues around climate justice and racial justice. So we're a multi-issue organization. In 2022, around mid-year, we became aware through National PNHP and David McClanahan, who's on this call, about the program that was at that time the Trump program that was called geographic contracting, direct contracting, which was a major move to try and privatize traditional Medicare. We went on board in opposing it, and very shortly after, I think through the influence of PNHP, the Biden administration eliminated geographic contracting, but substituted for it ACO REACH, which was supposed to be in some ways different from direct contracting as far as we're concerned. It was basically cloning the program with kind of painting lipstick on a pig. And actually, that's really unfair to pigs, who are really quite wonderful animals. So we waged a campaign, an educational campaign, as well as an advocacy campaign to try and stop the Biden administration from implementing ACO REACH. Their start date was January 2023. At the same time that we tried to use our contacts around the country to let people know what was going on, and particularly people who are interested, well, in two different things. Number one, those who are interested in a single payer system, that traditional Medicare represents a vehicle to get there, and it was being rapidly privatized through these pilot programs and other programs within traditional Medicare. But also, we were just struck by the fact that so many of us that chose traditional Medicare did it because we did not want a third-party entity in between us and our providers. And here was CMS and CMMI inserting a third party in between the Medicare beneficiary and their provider in the traditional Medicare program. We had specifically chosen to not be in Medicare Advantage for a variety of reasons. And here they were inserting it in and then trying to get us to go to the networks within their ACO REACH program. We waged that campaign. It was a ferocious campaign that we waged. We spent much more money than we had running 2 sets of full-page ads in our 4 largest distribution newspapers here in Washington State. We had very, very tense meetings with staff members and with actual representatives and senators, talking about what a betrayal this is of traditional Medicare beneficiaries and how they had to stand up and stop it. We had 2 of our representatives who opposed ACO REACH, Representative Jayapal and Representative Smith. Our 2 U.S. senators, and the other said, no, we want to wait and see. We think that this value-based pricing has something to it, and we should give it a chance to see how it works. We developed over the course of that campaign into towards the end of 2022, an understanding that the problem was much deeper than just the problem of the privatization of traditional Medicare. The problem was the privatization of Medicare, straight. That what we're seeing was the insurance industry and private equity actually taking over the Medicare system and turning it into a profit center. We read analysis from Wall Street firms saying that the money now is in Medicare. We began to see companies like Amazon, who, as you know, is based here in Washington State, purchasing primary care provider practices who were involved in the ACO REACH program. We saw United Healthcare through Optum purchasing 2 of the major clinics here. And we saw them expanding like crazy and offering benefits. Frankly, people were being offered premiums of about $18 a month compared to the incredible cost, the cost of traditional Medicare, where you're forced to buy a Medigap if you don't want to have yourself exposed financially. And we saw our own members, as well as people around the country, making the choice to be in Medicare Advantage because, as we know, the income inequality that we're facing as a country has playing out in spades with seniors and people who were going into Medicare. And so they were making choices based on their economic interests, not understanding what the consequences could be. That is the whole consequence of limited provider networks, the ability of these Medicare Advantage plans to deny coverage, prior authorization. And we were hearing stories like crazy, and well, like crazy, a number of stories we were hearing from our own members about it. So we decided that we would launch a campaign to stop, not only stop the privatization of Medicare, but to try and get others to join with us to push it back, to actually eliminate privatization from Medicare. Now, you talk about, you know, David taking on Goliath. This is that. This is David taking on Goliath, because we are taking on some of the largest capitalist corporations in the country. You know, you look at the 5 largest Medicare Advantage insurers, and you look at the equity firms and the private corporations that are going into Medicare, and you realize, you know, what they want by 2026. The expenditure from Medicare is going to be about $1.6 trillion. And this is easy money for the pickings. All they have to do is engage in overcharging and fraud. And when they're caught, they get their hands slapped. So we began a campaign which had a number of different aspects to it. One part of the campaign was to educate people about what was going on. We're using our newsletter, The Retiree Advocate. We run front page articles every month on what's going on with Medicare, traditional Medicare, Medicare Advantage, the kind of ripoff that's happening, the fleecing of the Medicare Trust Fund, how they're doing it. And we're having webinars. We're having 4 webinars this year. With the next one coming up is on June 5th with Wendell Potter, who's going to be talking about pulling away the curtain on how these companies are committing fraud. We're working very hard to try and nationalize this campaign. We're working with Social Security Works, which we had been working with all along. We're now in discussions with Be a Hero. We work with the Labor Campaign for Single Payer. We're looking for other partners to nationalize this campaign. We have got to stop. We have got to drive back this privatization, or else what we're talking about, if we're going to talk about Medicare for all, is a privatized Medicare for all. So that's the nature of the campaign that we're running. I can go into the details about how these companies are basically overcharging and defrauding the Medicare Trust Fund and are denying care to beneficiaries. I mean, the Office of the Inspector General of the Health and Human Services said that 13% of the denials of these Medicare Advantage by these Medicare Advantage companies would have received those services if they had been in traditional Medicare. We have members. We had a story from one of our members who was in Medicare Advantage. And the sad thing is that once people are in Medicare Advantage for a year, they do not have guaranteed issue of Medigap insurance, except in 4 states in the country. So they're stuck. They're basically trapped in Medicare Advantage. And unless they can find an insurer who's willing to write Medigap insurance for them. So I can stop there and open it up to questions, Chuck, or I can go into more depth if you'd like me to. I'm open to whatever I can do here. I'm hoping. Here's my hope from you all. My hope from you all is you all will take up in a serious way, as you're fighting for single payer systems in each state. I mean, one question that you have to answer is, how does that happen with Medicare Advantage? Is there a way that the states can deny Medicare Advantage, which are national plans, the ability to sell insurance in your state? I mean, I think it is a huge obstacle for any of us, whether we're talking about state-based single payer or national single payer, to win this battle unless we drive back and drive out of Medicare the insurance industry and the private equity and make it a public, comprehensive, affordable healthcare system. So that's my presentation. I'm happy to answer any questions.
Terrific, Robby. That was really excellent. Thank you for the substance, the passion, and the power, and the strategy, and the thinking, the work that PSAR is doing. As you know, we're engaged in regular meetings with you and other partners, and we'll be continuing that work. And we ask folks assembled here, if you're interested in jumping in, just let us know. Reach out to Mike or myself. And support the work that we're doing at One Payer States to fight privatization. This has been a recurring theme, and it's not just in the area of healthcare where things are being privatized. It's happening in all institutions. So we need to see the interconnection as well. What neoliberalism on steroids looks like. It's in the process not only of destroying Medicare, but also destroying so many of our public institutions. So thank you for that, Robby. I see that Steve Auerbach has a question related to the Mayor Adams in New York has thrown Medicare or municipal retirees into the Medicare Advantage program as a way to deal with their budgetary problems. Steve, do you want to come up and frame that question for Robby, or Robby, do you want to just run with what your understanding of what's happening in New
I
York
just wanted
and
to
why
make
that's important?
sure. Yeah, I
Steve?
just want to make sure everybody was cross-connected. We've had, and I understand that they've reached out to sort of organize nationally from New York. So you've probably met somewhere in the middle of the country, I guess in Oklahoma or something, midway.
On Zoom, Steve. We've met on Zoom. Yeah.
With the
And I'm going to be at a
meeting.
meeting. I'm going to be at a meeting on Monday with different state public employee groups to talk about this.
So you're in connection already with the folks from Croc.
Yeah, I am. Yeah.
So that's, I mean, and just for the single payer advocates, just so you should know, within Croc, not all the individuals are necessarily single payer supporters, but we have one of the Croc leaders is now actually on our New York Metro board, Julie Schwartzberg. And we've been quite supportive of them organizationally. And it's been fruitful. I think they've, for the moment, lost their immediate fight because the unions, on behalf of what they perceive to be their current members' interests, as well as whatever other reasons, caved and completely. So it was left to the retirees, in effect, fighting their own former unions. But the fight goes on. And I also want to just, while I'm here, to second the point about the connection to, in general, the takeover by private equity and venture capital and those malefactors. We did a forum here in New York on that, had some good educational material, and also groups like private equity stakeholders, and also some of the anti-monopoly groups. So American Economic Liberties, I recommend those kinds of collaborations going forward, the anti-PE folks and the anti-monopoly folks.
Can I comment, Chuck?
Of course. Go ahead, Robby.
So I have been working real closely. In fact, this past Monday, I had a meeting with Martha Boardman and Julie and others, and they were talking to me about strategies. And I think everyone needs to be aware of what's going on here in a number of states around the country. And we were able to push it back in Washington and stop it. But in a number of states around the country, the retirees, public employee retirees, are being forced into Medicare Advantage plans. And so the retirees are organizing. The tragedy in New York is that the city, particularly, is they're having to fight their unions that they retired from. The two biggest unions they're having to fight, and that's the tragedy there. But it doesn't have to be that way, because here in Washington State, the union supported us as we created a coalition to fight our Public Employee Benefits Board from forcing our public employee retirees into a Medicare Advantage program. But it is another area where we are collaborating. And in fact, Croc which Steve mentioned, is meeting on Monday, and there's going to be discussions with other national groups. And once again, we are saying to folks, we have to stop this privatization. We all have to join together and build a movement. But the other thing I'm saying is we got to be organizing, because one of our greatest enemies is that people don't know what the hell is going on. Most Medicare beneficiaries, many Medicare beneficiaries don't even know they're in Medicare Advantage, and they don't even know that that's not traditional Medicare. We just held a forum out in Port Angeles in Washington, and afterwards, a couple came up to me and said, we think we're in Medicare Advantage. And then they started explaining to me, oh no, they had Medicare Part D and they had supplemental. I said, no, you're in traditional Medicare. And they threw up their hands in joy to learn that that's what they were in. People don't know. They don't understand what's going on. So part of our task is to let people know what's going on and the existential threat that this takeover by private equity and the large insurers is having on our Medicare program. I'll say one more thing, and then I'm sorry, I don't mean to cut Charlie, you or Cheryl off. I don't know how many of you are aware that Humana has announced that they are leaving the private insurance market and are solely going to concentrate on Medicare and Medicaid as their area of insurance. They are making so much money off of these programs. They're allowed to make 15%. That's compared to 2% administrative costs for traditional Medicare. They're allowed to take 15% for profit and administrative costs, and the ACO REACH are allowed to take over 25% for administrative costs and profits. Kip Sullivan, who I think many of you might know, is doing an analysis, and we're planning to delve deeper into that with him, that says that these Medicare Advantage plans are taking 40% in overcharges from the Medicare Advantage program and from the Medicare Trust Fund. We need to get a clear analysis and then figure out how to explain this complicated thing to lots and lots of people, but we're going to try and understand it. Charlie, you had a question.
Yeah, thanks, Robby. So my question relates to one of the strategies that people have come up with. If the State-Based Universal Healthcare Act or something like it does not pass, in order to include Medicare, one notion is for states to become a Medicare Advantage insurer. And I'm wondering what you think of that, and is that of any value, and would it be of any value to do prior to SABUCA, just to have for a state to take advantage of the extra benefits that can be offered through a Medicare Advantage program? And then the other related question is, have you thought about joining the anti-privatization of Medicare with the anti-privatization of Medicaid? So sort of two questions there.
Okay, so let's start with the notion of the states creating a self-insured Medicare Advantage program. That's what we're talking about here, right?
Yes.
I know that we are just in the process of having the final negotiations on our state budget for Washington. And in it is a budget proviso that the healthcare authority here in Washington has to look at other options for creating self-insured Medicare benefits for retirees. Now, here's the problem. If you call it a self-insured program, you don't get the subsidies from the federal government. If it's called a Medicare Advantage program, you do. So, the state is not an insurer, and so I don't know what it means to say that the state can move into taking the place of an insurance company, whether the state can do that. and whether they'll get the subsidies, those incredible subsidies that the federal government are providing Medicare Advantage, because the problem with the classic Medicare program that our public employee retirees have now, and the supplemental on that, is what's called the Uniform Benefits Program, which is what is one of the programs that's a self-insured program within the state. What happened with that is the state was unable to get the subsidies for that program from the federal government that were given to the Medicare Advantage plans. So that program became incredibly expensive. So I don't know whether that's a viable option, Charlie. I just don't know.
So let me add to that people have done analyses, and when they look at the rules, I mean, you have to actually apply to be a Medicare Advantage program. And from when they look at it, they say there's no reason that a state could not do that. So, but they actually have to apply, and they have to say, yes, I want to be a Medicare Advantage program in order to get the subsidies. Now, no state has tried it, so we don't really know if it could work, but it seems like it would. And so it seems like there is an advantage in saying, yeah, I really do want to be a Medicare Advantage program, not just a self-insured program.
Let me ask you a question, Charlie. Do they therefore have to have a limited network and prior authorization? No, they don't.
No,
they can
mean,
have
the limited network is up to the entity saying, well, who do I want to have in my network? And it can be everybody, as far as I know. Right. But again, no one's tried it, so we don't really know.
Right. That's really interesting, Charlie. And I don't know the answer to your question.
Okay.
What was your second question?
The second question is the effort to work against privatization in Medicaid, and sort of joining that with the effort to work against privatization in Medicare. I mean, Connecticut is probably the best example of a state that actually did that, and then it seems like it would be useful to merge those efforts together, or maybe it would be. I don't know. So
I agree with you, and that would be what we are working are developing a working relationship with Be a Hero. I don't know if you are acquainted with Be a Hero, but it does absolutely represent a significant force within the disability community, and they have decided to prioritize as what they're going to work on. They decided that in February of this year, the privatization of Medicare and Medicaid. So in answer to your question, it's yes, and we are, and I know that Be a Hero is holding a national organizing meeting this coming. Let's see, I think it's this coming Monday. Excuse me. It's on May 1st at 5 p.m. And they have an email list of 400,000, a distribution list of 400,000. So just bringing them into this fight means we're going to not just be talking about Medicare, we're going to be talking about Medicaid too.
Yeah. And is there a time for that on May 1st?
It's 5 p.m.
Pacific.
Is that Pacific time?
Yeah. And you have to register, and I think you'll have to look at that. And they're putting the program together. We don't have. Go ahead.
Well, one last question, and just that this is really more of a personal. I want to connect with you and see if you can present to an Oregon group on this kind of stuff you're talking about today.
Sure.
Okay.
Sure. Just either me or someone else from the Pizarro Organizing Committee.
Yeah.
Okay.
All right.
Dave McClanahan, are you in a place to drop some links for Pizarro while Robby's presenting here, just so that people can know how to sign up for the newsletter, maybe contribute to the work that you're doing? Are you in a place to do that, Dave McClanahan? Thank you.
Dave, you're muted, brother.
What do you mean in a place? I'm about to send out a blast about our monthly meeting from Wednesday night. I'm going to send that out today because I've just gotten it up onto YouTube, and I plan to, put some stuff in that blast about upcoming events, and I plan to, mention some of the Pizarro stuff.
So you just want to put a hyperlink in the chat, a hyperlink for Pizarro.
I tell you what I'll do. I'll put the Pizarro website in the chat.
That'd be great. So folks know how to stay connected here. And you keep mentioning, I don't even know the acronym. You mentioned CROC. What is that? CROC?
You'll have to ask Steve what it stands for. I only know it as CROC.
And then related to Charlie's question, Steve was putting something in the chat, and this isn't to keep you, Cheryl and Judy, from coming up, but just want to clarify a couple things here. We'll circle back with you, Steve and Charlie. Let's bring up Cheryl and then Judy. Cheryl?
Yeah, thanks. I just wonder how much connection do you have to teachers? There's a lot of parallels, as I'm sure you know, between the charter movement and what's happening with Advantage. And the charter schools started off looking innocuous, and they have an increasing ability to siphon off money from the public schools. And do you know about Labor Notes? It's a newsletter. Okay. Do you, if you're connected to them, and maybe you could produce a piece, or I mean, I think they're terrific. And the more we connect with teachers, I'm a teacher.
Our co-president, Jeff Johnson, I believe, wrote a piece for Labor Notes.
Okay.
And he does write for them. What I want to say, you asked how are we connected with teachers. I mean, there's a couple of answers. In Washington, we are in the coalition with the teachers unions around stopping the privatization of teachers' retiree benefits. That was part, the teachers, the state employees, and then several retiree organizations all came into a coalition to stop the healthcare authority in Washington. And we had the support of AFT Washington, and the WEA, the Washington Education Association, is also involved in that coalition. AFT Washington is also supportive of the work we're doing. We don't have much of a connection with WEA other than that coalition to stop the privatization of retiree benefits. I know that in New York, it's a tragedy, because what's happening in New York is what is it? United Teachers. I think they're part of AFT. They are absolutely fighting their retirees and making, they're on the other side of trying to stop the privatization. So we were fortunate in Washington that we had the unions with us. I come out of the labor movement. I'm a retired out of the Plumbers and Pipefitters Union, and then I worked for our state labor council for 15 years. And Jeff Johnson, who's the co-president of Pizzara, was the president of the state labor council for 8 years. So we have deep, in fact, our offices, Pizzara's offices, are in the building that's owned by the Washington State Labor Council. So we have deep connections with the labor movement. And they're very supportive of us, which we really appreciate. And we find what's happening in New York State unforgivable. Unfortunately, and this is really sad, unfortunately, the AFL-CIO is involved in offering a Medicare Advantage plan. And there are a number of unions that are pushing people into their Medicare Advantage plan. It makes no damn sense. How can you be opposed to privatization and at the same time be supporting privatization in Medicare? It makes no damn sense. And Jeff actually wrote, we know the president of the AFL-CIO, and Jeff was on one of the advisory boards to the AFL, wrote a letter to the new president of the AFL-CIO saying, what are you all doing? This is something you're going to live to regret. But the things that the Medicare Advantage plans do is they provide a little bonus that's annual to those organizations like AARP and others that go ahead and promote these Medicare Advantage plans to their members. Per member, there's a little bit of a kickback. That's how AARP gets all their money. Is they get most of their money through their Medicare Advantage plan, which is a United Healthcare Advantage plan, and they get a little kickback for each member who joins up with the AARP Medicare Advantage plan, and also the United Health Medigap plan as well, although the bonus is a lot less for the Medigap plan than it is for the Medicare Advantage plan. So, and answer your question, we do work with teachers. We have retired teachers we're working with. The teachers in New York are really pissed, because they feel like their union is selling them down the river. And in some ways, they're right.
Do you
It's
have a sense of nationally how much of an outlier New York is, or is it?
we don't have a friend in the national president of AFT, I'm afraid.
Thank you.
Yeah.
Yeah, as an AFT member myself, yeah, Randy Weingarten's not our friend. Thank you for that, Robby. And Steve did put the acronym in there, Cross Union Retirees Organizing Committee. When we start talking in acronyms, some of us get lost. Thank you so much, Steve and Robby, for your response, and Cheryl, thank you. Judy, and then Mike.
Well, part of it I see as union management becoming the establishment. It just reminds me of what's going on in California, even in terms of the state party is kind of squelching the caucuses, and I see it in the labor thing. But what I'm thinking of as a deterrent, or as something that needs to be addressed, is maybe extending HIPAA to Amazon and all these other places where they cannot use. People don't understand. Amazon is using that to gain even more information about you. When they have the pharmacy and the doctor's clinics and all the other stuff, plus what you buy online, what you buy at their stores, what you buy at the market, markets that have pharmacies also, and you have your little card to get your bennies, they're collecting data on you to market. So basically, well, it's like GoodRx. The reason they can do so much, they're so cheap, is that they harvest every bit of information from you from Facebook and everything else. So I don't think people realize that once Amazon and those people come up, you think the government has, are reaching into you. It's Amazon and Facebook and all these guys are going to have a complete picture of you. They're going to know when you're a diabetic and you buy booze, when you go to fancy dancy restaurants or whatever, they're going to know the complete picture on you. So to me, you need to take that incentive out. And if it's HIPAA or something like that, so that they cannot share that data with the other entities in their groups, we might have a toehold, but I don't know how much. I haven't thought it all the way through.
All right, Robby, any thoughts?
Well, I need to comment on what Judy said about labor leaders. I think we have to be very clear about the tough spot labor leaders are in. I don't agree that maybe some labor leaders are acting like business managers, but I think most are just trying to figure out, how do you navigate building a labor movement in this country, in what is the most anti-labor union country right now in the, in the developed world. And what happens is that they need to have funds in order to be able to run their organizing campaigns. And unfortunately, they're making some decisions that are not good decisions about how to access those funds. But it's not so simple. They're not part of the establishment. The establishment would like to squash them like bugs. We should be clear about that. They would be happy with a union-free country, honestly. So I'm critical of what the AFL-CIO is doing. I'm critical of Randy Weingarten and what the unions, I'm really critical of what the unions are doing in New York State. It's unforgivable. But I think that what happened in that is my understanding of, and maybe Steve can correct me on this if I'm wrong, is back in the Blasio negotiation on contract, it was agreed that the Blasio negotiated a contract, and the unions agreed they would find ways to cut costs in order to pay for the contract that they got for their members. And they made a compromise with the devil. and decided that the way they're going to do it is by forcing the retirees into Medicare Advantage. And, you know, that's what happened. Now, you know, that the fact that they were able to pit the actives against the retirees and allowed that to happen was tragic and should not have happened. Steve, I'm just wondering if that's consistent with what your understanding is, if you're still on.
Yes, absolutely.
Yeah.
The only thing I would say is it's New York City, not New York State.
Yeah,
There's
you're
different
right. You're right.
unions
Yeah,
involved, and that some of the, it's not all of the unions. So you're right. It was the two largest ones, including
that's
the
right.
teachers union. And because it was a weighted vote in the council, so it was actually, if you count number of unions, the majority were opposed to it. But of course, they were these small scattered other unions. And given the weighted voting in the Municipal Labor Council, they went on and approved it. But it was an absolute classic reason why we should get healthcare off of the labor negotiating table. It was an absolute classic example of that. Yeah.
Thank you. Thank you. And we can pick up this thread on the other side. I want to respect the folks whose hands are up, but it's expanding on Judy's question, I think is implied there, the use of artificial intelligence, right? AI in denying, right? You know, that's gotten some press out there, but maybe you can comment on that on the back end after talking to
Yeah, sure. I mean, we just dealt with the use of AI in our family. My daughter-in-law, her mother was very, very ill, was in the hospital, and in New York, in the Bronx, and that from the hospital she went to a skilled nursing facility, and they had a United Healthcare Medicare Advantage plan. After 18 days, the United Healthcare said, well, we're not going to pay for this skilled nursing facility anymore. You either have to take her home and pay it yourself. What we learned subsequently is these companies are using AI to determine how long someone should be there, you know, how long someone should be staying in a skilled nursing facility. In this case, she had a catheter in. She was not able to dress herself. She was not able to get out of bed by herself. So, you know, they made the decision, and our daughter-in-law's family couldn't take her home. She was in no shape to be taken home. She appealed the decision. It was denied once by United Healthcare. She appealed that appeal. It was denied again by someone that United Healthcare hired. And then she went to an administrative law judge. She took it to 3 appeals. Most people do not do that. They just don't do it. She took it to an administrative law judge. There were 2 instances. One was they were going to send her home. Then she got some kind of infection. And so they started covering again, and then they cut her off again. So there were 2 different appeals. In the first appeal, I mean, my daughter-in-law just did a fabulous time of bringing in all the medical records to that administrative law judge. And of course, the United Healthcare lawyer came in and said, okay, we'll agree to pay the first 4 days of that period of 11 days, but we won't pay the last 7. And but Jen, my daughter-in-law, made a great argument. Then there was a second appeal on the second set of days. And in that one, the same lawyer came in from United Healthcare and said, okay, we're going to pay the whole thing, because she had all of her stuff together. She had gone through all the hoops. And we just got the opinion this past Monday from that first appeal, and the administrative law judge found that they should have paid the whole damn thing. But just think about the hoops that they had to jump through in order to get them to pay what they damn well should have been paying. AI was what they used to determine how long someone should be in a skilled nursing facility, regardless of what the doctors and the providers are saying that they should do. It's criminal. It's not criminal, unfortunately. It's unbelievable.
Yeah, immoral, unethical, all the
Right.
above.
Yeah.
Right. Mike, and then Bill. Thanks, Robby, and thanks, Judy.
Yeah, just a nuance. Our National United Church of Christ denomination recently, not forcing, but offering Medicare Advantage to retirees. And we raised this with our conference here, and the conference minister said, put together a resolution to condemn this kind of luring retirees into Medicare Advantage. And it surprised me, because if the national does that, it's going to be very expensive to give up their low Medicare Advantage premiums and take on Medigap. But he feels morally directed to create a resolution. So that's another option that all of us can take, is through our churches. And if you want a sample of the resolution that we're using, let me know.
Thanks. Okay, let's jump over to Bill. Bill Semple. Thanks, Mike, for that. Bill?
Thanks, Chuck. Yeah, I'm wondering, in terms of understanding the impact of privatization, has there been research into the 85% that Medicare Advantage is supposed to be spending on medical care that really is administrative? Like, I think I've read that the claims denials process are really considered part of the 85%. And I'm wondering how extensive that is. I imagine auditors can figure out how to pack all sorts of stuff into that 85%. And if that might be a way of showing just how corrupting the privatization and the profit motive is.
Bill, it's a very timely question and a good question. The person who I know that's doing the deepest research into that is Kip Sullivan and a band of people that are working with him. And the most recent email from Kip is that he thinks that about 40% of what is paid to those Medicare Advantage plans are overcharges, or being used for those purposes. Now, we don't have the data yet, and part of what we have to do, because we are not going to win this battle unless we build a movement. And you know, the only way to build a movement, and those of us who lived through the 60s know the kind of hard work that it is to build a movement. You got to be willing to go out, you got to be willing to do the education, you got to be willing to go out and do the presentations. You got to get people understanding what's going on and willing to take some action about it. So we are wanting to somehow get a way to talk about that. Right now, we're just focusing on 2%, 15%, 25%, right? Because that we have the data for, right? We know those things. If we can actually make it possible to talk about how much more it is than the 15%, and we don't have enough data on ACO REACH at this point because it's just started this year. But if we can get the data to prove that it's much more than 15% with Medicare Advantage, and we can explain it in a way that's understandable, that is cherry picking, lemon dropping, upcoding, other bonuses that CMS is paying to these insurers. If we can put it in a way that we can explain it to people in a 45-minute presentation, we're trying to figure out how to do that. But you know, I'm sure you're right. I'm sure that it's much more than 15% that they're doing. One thing I just want to mention here that I didn't mention in my talk, you folks in California, I just got a copy of the resolution that's being brought to that's going to be in the California legislature. It has a sponsor calling for the California legislature to come out against ACO REACH. The resolution, I think, was just introduced this week. And it's going to be an effort to try and get it through the legislature, and it then goes to the president and to their congressional delegation. And that's being led by the California Alliance for Retired Americans and by the National Single Payer Network that are doing that. Now, I don't know if folks from the California One Payer State Network are involved in that at all. If you are, I apologize for not mentioning you. But I think it is another way to raise the issue about the privatization of Medicare. And I just think it's important for folks in California to know that that's happening if you don't know about it.
And you said you have a copy of that resolution?
I do. I just got it from Kay Tillow. Yes.
Okay, well, we're happy to share that template. If we've long talked about creating an ALEC on the left, right? Like the American Legislative Exchange Council that shops around, model bills. This is the
Sure.
kind of thing that would be helpful to push in the other.
This is just focusing on ACO REACH, though. This is not focusing on Medicare Advantage. And I will send it, Chuck, to you and Mike at the end of this conversation.
Okay, terrific. Yeah, we all love to share. I've dropped the Pissarra link into the box a couple times. Also want to encourage folks to support the work that we're doing at One Payer States, both in the deprivatization space, as well as supporting our states, as well as getting the enabling legislation done with Ro Khanna in Washington. So there's a ton going on. I can't tell you how much. I'd love to. We were down to 2 minutes at the end of the time here, but really, we really do need the support. And anybody who ever wants to reach out and have a conversation, and so you know where your support's going, I'm happy to do that. Mike, your hand is up, and then Robby, you can make a wrap-up comment. Mike?
Yeah, Robby, I think you sent it to me, but for everybody else, could you send us a reference that confirms the 25+% that ACO REACH can take from this? It's deeply embedded in the rulings, but I'd like to have it easy to access.
I'm not sure that I have that at my fingertips, Mike.
Okay, I'll find it and share it.
But Kip Sullivan does, and
Okay.
Ed Weisbart has it too.
Okay, thank you.
You should go to Ed. Ed can get it to you.
Okay, thanks.
So I guess the one thing I want to invite you all to do is I think you'll find our newsletter, the Pissarra newsletter, helpful to you. You can see the past issues of the newsletter on our website. You can see we began running those front page articles in January with our organizing plan that was written by Jeff Johnson. So I invite you, one, to go to the website, look at what you've missed in 2023, and then I invite you to subscribe to the newsletter. I think you'd find it valuable and helpful. It is only $20 a year, and you can get it either in hard copy or electronically. Number two, I want to make you aware that on June 5th at 5 p.m., we're doing that webinar with Wendell Potter, and he'll be writing the article for the June issue. The name of that webinar is Pulling Back the Curtain, Lies, Fraud, and Profiteering, and Medicare Privatization Schemes. We just did a webinar with Ed Weisbart. That's on the website. It's on the homepage. You're welcome to watch it. He did a great job of explaining what's going on here, and I want to just recommend it to you. But we'd love to have you join us. Also, we meet monthly through an organization that a coalition Pissarra formed called Social Security Works Washington. We meet monthly with Alex Lawson from Social Security Works, and he gives us a rundown of what's going on in DC, both around Social Security and Medicare. If any of you are interested in being on the distribution list for Social Security Works Washington, you can email me. I chair that coalition at Robby, ROBBY.Stern, STERN @gmail.com. And I'll send you the link to participate in Social Security Works Washington meetings once a month. And they go for about an hour and 15 minutes. Thank you. Thank you for this invitation, Chuck and Mike. I very much appreciate it. And I would welcome coming back at any time. And David McClanahan, did I miss anything, or did I cover what I needed to cover?
We're all good. And your email address, Robby, again, your email?
It's Robby, ROBBY. I'm going to put it in the chat. Robby, ROBBY.Stern. Here it goes.
Dave, any final word up there in West Seattle?
Well, I just want to say once again how appreciative we all are here that Pissarra is leading the charge really across the country, and Robby and Jeff and Karen are really role models for all of us to follow. If you ever see them doing something, tune in on it.